Hi, my name is Joe, and I'm 37 years old. I'm a physical therapist, married with 2 kids and a dog. I work in an outpatient orthopedic setting. I really enjoy working with patients, helping them achieve their goals, getting them back to their activities that they were doing before their injury or before the surgery that they had. In my free time, it's really just a lot of time with the kids. Love running around in the yard and doing different activities, whether it's kicking the soccer ball around, playing catch. Kids are getting into golf and baseball, also pretty active, taking care of the house and yard work. I also really enjoy playing golf and getting some exercise in when I can. A lot of times injuries can come because you're not taking that time to invest back into yourself. You're kind of putting everyone else first. So my injury first happened when I was at work. I was actually working on a patient who had a lumbar disc herniation, and I was leaning forward doing a mobilization technique, kind of hinging forward from the hips, just like I've done 1,000 times before throughout the course of my career. And I felt the pull in my low back. Over the course of the next few days, the pain got worse and worse. And by the time that Sunday morning rolled around a couple days later, it took me about an hour to get out of bed. It was just an excruciating pain. I couldn't stand up straight. I actually had to use crutches to walk through my house and to get to the doctor's office. So as far as my symptoms kind of started and progressed, it was all primarily low back pain to start. And then over the course of about a week to 10 days, I began having some left-sided symptoms into my leg, as well as some right-sided symptoms as well. But I definitely had a good amount of numbness and kind of burning pain down into my legs. It was definitely pretty scary, pretty nerve-wracking thing to go from an active, healthy person without any real injuries to being basically incapacitated and having a tough time just trying to walk down the hall in my house.
My name is David Bombach. I'm an orthopedic spine surgeon. My entire practice is dedicated to the treatment of spinal care. I've been sending Joe patients for the last decade or so. He's highly talented. He's extremely knowledgeable of all spinal conditions. So it was almost ironic that he contacted me via text message and said, "Hey, I think I've got a herniated disc."
So when I saw Dr. Bombach, he gave me 2 options. He said we could try an epidural injection, and he said the likelihood of that helping was probably very slim to none. And then the other option he gave me was surgery. And we talked about discectomy, and we pretty much at that point agreed that we would probably proceed with surgery. As I got up to walk out of his office, he kind of got a little smirk on his face and he said, "Actually, Joe, there's something I want to show you." And that's when he took the Barricaid device out.
I was intrigued by the Barricaid device. It was a new device. It had just been approved really during the pandemic, but the data from Europe was strikingly impressive. This was a randomized controlled trial that looked at over 550 patients, and I was blown away by the results from the trial, to the point where I felt that not offering it to patients that were meeting criteria would be doing them a disservice. And I sat down, and Joe's an easy guy to talk to because he totally understands the anatomy. So I gave him both options, and I said, "Hey, after a microdiscectomy procedure, you're going to have a small defect or a small hole where that disc herniation emanated from. Think of it like a pothole. Are we going to lay down some gravel? Are we going to pave that afterwards? Or are we just going to leave the pothole there and then just see what happens?"
He kind of described the risks of reherniation as being as high as 1 out of every 4 patients, or a 25% chance of herniating your disc. And he said with the Barricaid implant, it could be as low as a 4 or 5% chance of reherniating. So in my eyes, 1 in 4 chance of reherniating versus a 1 in 20 or 1 in 25 chance, to me it was kind of an obvious choice for me to make.
The problem with the microdiscectomy surgery traditionally is that there is a risk of a recurrent disc herniation, meaning more material can come out of the disc once the disc has been removed. And that can set you up for the second surgery and possibly a third herniation, which might then lead you down the pathway of a spinal fusion. With the Barricaid device, we know that we can significantly decrease that reherniation rate.
So I went back to work a little over 6 weeks post-op, and it was definitely a little nerve-wracking. I do a fair amount of manual therapy, so My job as a physical therapist can be a bit labor intensive with moving patients' bodies around, pushing in certain directions. But after a week or two, I was back and 100%, definitely confident that, I had the Barricaid implant in my back and wasn't too worried about anything happening from there.
For patients with the Barricaid device, my protocol is slightly different. I feel that they're more protected because we have this barrier now that will prevent reherniation at a significant rate. But with my Barricaid patients, I do allow them to return to work and activities faster. I let them return to normal activities without any significant restriction.
So if I was talking to a patient about discectomy surgery, I certainly would tell them to be confident in that decision to have surgery. As scary as it can be and as nerve-wracking as it can be, there's light at the other end of the tunnel. And to me, having surgery and ultimately being a candidate and having the Barricaid implant was my clearest, quickest, kind of most sure path back to getting my life back again. So for me, the decision was pretty simple, pretty easy, and I would definitely share my story and encourage others in my shoes to pursue discectomy with the Barricaid implant.